So, what do you see as the future of chiropractors in our traditional healthcare system? I know you guys get talked about as being alternative and all that kind of stuff. So, how do you see that? How do you guys see the role of chiropractors fitting in traditional medicine?
I think the more we move throughout time, if you go back 100 years ago, you've heard of quack practors or quacker practors or all the different
Yeah,
names we get, or fake
yeah,
doctors, or all the
yeah,
stuff they
yeah,
come up
yeah,
with. Um, and now when I go meet with doctors, I don't want to give names out, but I have a couple orthopedic surgeons I treat. I have a couple dentists that I treat. Of course, my brother's one. I'll call him out on here. I adjust him from time to time. They're getting more respectful as time goes on because studies are coming out showing the health benefits of chiropractic care. I mean, 30 years ago, we didn't know that movement was really key to life. You didn't hear
yeah.
too many people talking about that as you do now. Um, and so I think the further we go on and the more people get educated on chiropractic care, and that's mainly why I wanted to be on here. I have so many people come in every day that don't know what chiropractic care is and why would it help me? Well, let me feel your back and explain a
Yeah.
few things and I'll show you. I think it will become more mainstream the longer we go. Now, I don't mind not being completely mainstream. It doesn't bother me at all.
I'm
And
the
I
same
like
way.
and I like being out on my own.
Right.
I
Yeah.
like having my own business and out
Yeah.
on my own
Yeah.
and not have anybody looking over my shoulder. Um, I think as the longer the time goes on, though, more people will start referring back and forth. I refer to doctors all the time. I love doctors.
Yeah.
And I refer people to your pharmacy all the
Yep.
time. I refer them to the hospital. I refer them everywhere. And so I think we all have our part.
Yeah.
And if we can find out that part, the better off we all are.
Well, I think one thing is that we have to realize that we all offer different things in the healthcare system. So,
Yes.
we can kind of always work as a team. I had a chiropractor tell me one time that actually one of the benefits that a chiropractor has, in some ways, a chiropractor might think that one of the tools that you don't have in your arsenal is you cannot prescribe drugs. In reality, in some ways, I'm saying this from a pharmacist standpoint,
Yeah.
in reality, that's actually to your benefit and possibly to the patient's benefit because you're talking about movement. So, what would a traditional doctor do? Oh, you've got knee pain today, Mr. Jones. We're just going to give you a drug and it'll help the knee pain, but it's
Yeah.
not fixing the problem. Whereas you, as a chiropractor, is actually fixing the problem. You want to comment on that?
Well, and I want to be careful because I don't want to raise any feathers if I've got some doctor watching this or something and say they're pill pushers or whatever, because I respect everything they do. Um, but sometimes it's like a band-aid on a bullet hole.
Yeah.
I say that a
Yeah.
lot, but um, I love that I can't prescribe medicine, to be
Yeah.
honest, um, because I have to fix them another way. I
Yeah.
don't have the option and I have patients come and ask me all the time. It says, Dr. Cox, you should be able to help me.
Yeah.
And say, well, can you prescribe me this or this or this? I'm like, no, I can't. We're going to fix this the traditional chiropractic way and make you feel better. I'm glad I don't have that out because I
Uh,
have to find a way to
yeah.
fix that joint without that.
Right.
And I think even a chiropractor, I see someone in pain, I don't like it. I
Yeah.
want to get them out of pain as soon as I can. And if I had some other way of doing it, maybe I would use it every now and then. And I don't like that I would use that.
Yeah.
I like that I have to do it another way.
Yeah, because there's definitely, from a pharmacist standpoint, I can tell you there's definitely side effects from those medications. So,
Yeah.
yeah. So what do you see as the future of your practice, and where would you like to see your practice go?
Man, that's a good question. That's almost a hard question. There's a I so I have one other doctor that works with me,
Mhm.
Doctor Nate Stewart. Um, right now we treat a lot of car accident patients at the moment. That's about what our practice makes up: half car accident patients, and then half your general patients that come in. I wouldn't mind getting one more doctor in my office to where we all have a little more family life.
Mhm.
I don't like to slave away. I like to spend time with my family. As much
Yeah.
as I love my patients or whoever's watching this, I also like to play. I watch your downhill mountain biking and all your stuff that you do. I like to snowmobile. I like to go fly my planes. I like to do those things. And I don't like to be stuck in an office Monday through Friday, even though I love my patients. I also have 3 little young boys. I don't care what they do. Dad will support them, whatever they want to do. But I want to have an opportunity for them if they want it.
Yeah.
And so I would imagine 15 years down the road, Man, I'll be an old man by then.
Not really.
When I want to slow down even more, that would be about the time that one of my boys wouldn't mind taking over or coming in for dad. And I love family businesses. I grew up on a family farm. And so I don't really know. That's a good question. I can't answer that. I've never been asked that.
I didn't know if there was a specific subset of patients you like to focus on, like athletes or, or families or,
we focus a lot on car accidents.
Yeah.
We treat a ton of car accidents. I think right now we have 40 accident patients at the moment. We just counted up this last month. Current patients.
Yeah.
Just for the little town of Motos Lake, that's a lot of accidents we treat, So that's, I guess, where we push it most of the time, is trying that out.
Now, you used to have a location in Pasco, correct? When you first opened up, you still have that? Oh, okay. All right. Tell us about that.
Yeah. Dr. Kurt Myers, it's auto accident chiropractic down there. And he does great. We have, 3 or 4 massage therapists down there right now. Got a nice front staff. It's there off of 68 and Burden Boulevard. And now he is only car accidents.
Oh, wow.
I mean, it's called auto accident chiropractic.
Yeah, right.
And Pasco's a little bigger. We have a lot more patient base to draw from as far as car accidents. But yeah, he does great down there. I've had that practice. I opened that in 16. So I opened this in 14. I opened that one in 16. And yeah, it's been great. I travel down there and meet with him quite a bit, but he pretty much takes care of all the patients.
Yeah.
I'll do his vacation relief. I had Dr. Stewart go there and do some vacation relief here not too long ago. So one of us goes down there from time to time, does vacation relief, but mainly it's just him taking care of the patients.
Yeah.